Asati. Welcome you all in my YouTube channel. Friends, today I am going to explain you about the topic slip disc in English on the demand of few of my non-Hindi patients. So let's continue with the topic slip disc. It is also known as herniated disc, degenerated disc, ruptured disc, prolapsed disc, and herniated disc prolapsus. Friends, before that, if you have not subscribed my channel till yet, kindly subscribe the channel and tap the bell icon to get the latest updates of the videos. And kindly see the video till the last, because in the last I am going to explain you about some of the homeopathic medicines which can be helpful in curing the slip disc. Now I would like to clear the myth of everyone that what is slip disc. So it actually doesn't slip, but there is injury to the connective tissue between the two vertebrae. Suppose that these are the two vertebrae and there is a cushion between these two vertebrae. So any injury to that cushion leads to lateral bulging of the inner material of the cushion. It gets bulged out to the lateral side and it compresses the nerves. This is actually what slip disc is. Now let's talk about the silent symptoms of the slip disc. So it may cause no pain to mild, moderate or severe pain according to the involvement of the nerve, according to the compression of the nerves. It may cause muscular weakness, numbness, tingling, motor affections, paresthesia on one side, or if the nerves of the both sides get involved or compressed, then it causes paresthesia of both of the sides. It may lead to paralysis too. It can cause one side of the affection most commonly, but it can also involve both sides of the body too. It can cause loss of bladder movement, loss of bowel functions properly, and sexual dysfunction too. Now let's talk about the causes of this slip disc. So accidental injury or trauma or any kind of blunt injury or continuous sitting habits or sedentary habits, squatting position, driving continuously, or any kind of torsional movements can lead to the slip disc. This rupturing of disc is most common in L4, L5, and it also affects L5 as well. Next commonly affected vertebrae are C4, C5 and C5, C6, C6, C7. These all are very commonly affected vertebrae where rupturing of disc takes place. Now let's talk about the diagnosis of the slip disc. So myelography, CT scan, digital X-ray and MRI can be helpful. Allopathic point of treatment is surgery, physiotherapy and some painkillers. Now friends, I would like to tell you about the homeopathic cause. One of the cured case of mine of this slip disc via homeopathy and some of the homeopathic medicines which can be helpful in curing the slip disc. Now the homeopathic cause of this slip disc is patient feels that I have done all the responsibilities toward this family, but they don't consider me as a part of family and they left me out. So patient feels outside the home. That's why lead to lateral bulging of this internal material of the cushion or connective tissue. Now let's talk about the cured case of slip disc via homeopathy. A patient age 51 years suffering from this slip disc, having too severe pain in the calf region, in the feet, in the lower part of the back, sensation of tingling, and there is numbness, stiffness is also there. And after taking whole history, we got patient is MB thermal and thirsty too much and craves lemons and thirsty for icy cold water. And in mental generals, we saw he was slow in answering. What we ask, he returns the answer in a very slow manner. And there is memory weakness, too much quarrelsome, defiant, desire to kill those persons who contradict him. He is too much restless and sweaty, and there is fear of dark and desire to escape. On seeing sharp instruments, he wants to suicide, and there is a suicidal impulse in him. He feels that everyone surrounding him are his enemy, and his family even don't consider him as a family member. He thinks like that. So he feels that his family will deceive him and they all are his enemy. So the rubric taken was delusion surrounded by enemies, and the medicine given was Moxal 200, which cured him completely within a period of 1.5 years. The first medicine is Rustox. So in this there is too much pain on crossing legs. Along with that there is restlessness, and there is tension-like pain as if muscles have been shortened. There is internal coldness of the limbs. And the mental generals of this Rustox is there is an yielding disposition of the patient. And physically he is very restless. There is fear of being poisoned, dissatisfied with everything, discontented with everything, and there is causeless weeping without knowing why. So if these symptoms correspond, Rustox will be helpful in curing the slip disc. The next medicine is camphor. So in this there is internal chilliness of the limbs along with burning, and violent cramps are there. And there is right-sided protrusion of the internal material of the cushion, or that is connective tissue. And there is too much chilliness with the burning. And the mental generals of this camphor is patient feels uncertainty in the outer world, can't fight or argue, and patient feels neglected. And there is one more important symptom of camphor is nothing satisfies him. He is very discontented person. So if these symptoms correspond, camphor will be helpful in curing the slip disc. That's all about this topic. We'll meet soon with a new topic, new subject. The clinic address of mine and the contact number is given in the description link. And it's my humble request to you all that kindly don't take any medicine without consulting doctors. So kindly consult the doctor before taking any medicine. So stay connected to stay healthy. Thanks for watching.